Module Overview. Evaluation and accountability are the backbone of long-term trauma-informed transformation. Without systems to measure impact, assess fidelity to trauma-informed principles, and adjust accordingly, organizations risk becoming performative rather than transformative. This module dives deep into the principles, frameworks, tools, and strategies required to evaluate trauma-informed care (TIC) practices, ensure accountability at all organizational levels, and embed sustainability mechanisms for long-term effectiveness. It aligns with key international standards from SAMHSA, WHO, Joint Commission, National Child Traumatic Stress Network, NCTSN, and the Trauma-Informed Care Implementation Resource Center. The role of evaluation in trauma-informed care. Trauma-informed care is not a one-time implementation. It is an evolving practice that requires ongoing feedback, data-driven learning, and reflection. Evaluation serves to monitor fidelity to trauma-informed principles, improve outcomes for clients and staff, justify funding and support, demonstrate accountability to regulatory bodies and communities, inform leadership for strategic decisions. Principles of trauma-informed evaluation. Effective trauma-informed evaluation is built on these principles. 1. Principle 2. End description. Safety. Avoid triggering clients or staff during data collection. Trust and transparency. Explain clearly how data will be used. Collaboration. Include diverse voices in evaluation design empowerment. Let participants influence metrics and evaluation goals. Cultural humility. Use culturally appropriate tools and interpreters. Non-punitiveness. Use findings for growth, not punishment. Principles of trauma. Informed evaluation. Effective trauma-informed evaluation is built on these principles. Principle description. Safety. Avoid triggering clients or staff during data collection. Trust and transparency. Explain clearly how data will be used. Collaboration. Include diverse voices in evaluation design. Empowerment. Let participants influence metrics and evaluation goals. Cultural humility. Use culturally appropriate tools and interpreters. Non-punitiveness. Use findings for growth, not punishment. Key evaluation methods. Quantitative tools, surveys, pre-post assessments, incident tracking, outcome measures. Examples: PTSD checklists, staff burnout inventories, client satisfaction scores. Qualitative tools, focus groups, storytelling sessions, open-ended interviews. Capture lived experience, emotional safety, and invisible trauma effects. Participatory approaches. Involve clients, staff, and community members in tool creation and result interpretation, builds ownership and inclusion. Reflective evaluation. Journaling, supervision logs, reflective dialogues. Ideal for monitoring vicarious trauma, growth, and emotional climate. Trauma-informed key performance indicators, KPIs. Domain sample KPIs. Staff wellness, % of staff participating in reflective supervision, burnout rates, staff retention, client empowerment, % of clients reporting they felt safe, informed, and heard. Policy alignment. Of policies revised with TIC principles. Training, % of staff trained in TIC annually. Environment. Client ratings of physical, emotional safety complaints, reduction in grievances or trauma-related incidents. These KPIs can be customized by sector, e.g. schools, hospitals, shelters, prisons.
Continuous quality improvement, CQI. CQI is an ongoing cycle of plan, identify gaps or needs, e.g. limited staff knowledge, do, implement an intervention, e.g. new training, study, evaluate the results, e.g. staff pre-post knowledge test, act, refine approach based on data, e.g. update training content. In a trauma-informed organization, CQI must include emotional, relational, and cultural metrics, not just procedural ones. Trauma-informed CQI is not about blame, it's about learning.
Building trauma-informed feedback systems. Anonymous staff feedback tools. Digital forms, suggestion boxes, pulse surveys. Track emotional climate, burnout, safety, and inclusivity. Client engagement mechanisms, regular focus groups. feedback walls with positive prompts, what made you feel seen this week, exit interviews and post-service follow-ups, community voice advisory councils of service users, partnerships with traditional leaders, faith-based organizations, advocacy groups, supervision and peer debriefing use feedback loops in reflective supervision and team debriefs. Accountability mechanisms. A trauma-informed organization uses multiple accountability structures: internal oversight committees for TIC compliance, TIC champions, or ambassadors in each department, leadership reviews that include emotional intelligence and staff safety measures, grievance procedures that are transparent, healing-centered, and non-punitive, annual TIC audits using SAMHSA's or NCTSN's evaluation tools. Sustainability of trauma-informed practice. Sustainability goes beyond budgeting. It's about embedding TIC into identity and operations. Strategies include policy institutionalization, codify TIC in hiring, onboarding, reviews, and strategy. Leadership succession planning. Train new leaders in trauma-informed approaches. Budget allocation. Include TIC in annual budgeting, e.g., staff care programs, training. Research and publication. Contribute to the field through case studies and evaluations. Accreditation pursuits. Obtain trauma-informed care certification to establish credibility. Accreditation and compliance frameworks. Organizations that want to achieve trauma-informed certification should use SAMHSA's Trauma-Informed Organizational Assessment Tool, meet Joint Commission behavioral health and safety standards, comply with national human rights protocols, e.g., NAPTIP, UNICEF guidelines, engage with national and regional health or social work boards, submit annual TIC compliance reports, undergo external reviews by TIC experts or evaluators.